Hello, thank you for passing by. My name is Manuel. When I was preparing for NCLEX, the cardiology session was the area I was really concerned about. Fortunately, with the help of USRN Elite, I was able to pass the NCLEX and get the support I needed. In today's video, we will cover key NCLEX RN cardiology questions, complete with answers and rationale. This is to help you feel more confident and relaxed during your exams. This video was sponsored by UNRN Elite, the best online NCLEX coaching institution. If you want to ace your NCLEX and dive deeper into ECG interpretation and calculations, make sure you enroll with them. Let's get into the questions.
Which of the following assessments is most important for a patient with a new diagnosis of atrial fibrillation? It's C. Heart rate and rhythm. Atrial fibrillation, AF, is characterized by irregular heart rate and rhythm. Monitoring these vital signs helps assess the effectiveness of treatment and identify any complications. A patient is admitted with chest pain and a history of myocardial infarction. Which medication should the nurse anticipate administering? It's A. Aspirin. Aspirin is commonly used to prevent further clot formation in patients with a history of myocardial infarction. It helps reduce the risk of subsequent cardiac events. What is the priority nursing intervention for a patient experiencing a hypertensive crisis? It's D. Administer IV antihypertensives and monitor blood pressure closely. A hypertensive crisis requires rapid intervention with IV antihypertensives to prevent organ damage, and close monitoring is essential. A patient with congestive heart failure, CHF, is being discharged with a prescription for a diuretic. What information is most important to include in the discharge teaching? It's A. Monitoring daily weight and reporting sudden changes. Weight monitoring is crucial for patients on diuretics to assess fluid balance and prevent complications from fluid overload or dehydration. Which of the following is a common side effect of ACE inhibitors? It's D. Dry cough. A persistent dry cough is a well-known side effect of ACE inhibitors due to the accumulation of bradykinin. This side effect can be significant enough to require discontinuation of the medication. A patient presents with symptoms of angina pectoris. Which assessment finding is most indicative of angina? It's A. Dull, aching chest pain that improves with rest. Angina pectoris typically presents as a dull, aching pain that is triggered by exertion or stress and is relieved by rest or nitroglycerin. Which laboratory value should the nurse monitor to assess the effectiveness of treatment for heart failure? It's A. B-type natriuretic peptide, BNP. BNP levels are used to evaluate the severity of heart failure and monitor the effectiveness of treatment. Elevated levels indicate worsening heart failure. For a patient with a pacemaker, which instruction is crucial to include in the discharge teaching? It's A. Ensure regular follow-up visits for pacemaker checks. Regular follow-up is essential to ensure the pacemaker is functioning properly and to make any necessary adjustments. A nurse is assessing a patient with pericarditis. Which finding is most characteristic of this condition? It's C. Friction rub on auscultation of the heart. Pericarditis often presents with a characteristic friction rub due to the inflammation of the pericardial layers. Which of the following is a priority assessment for a patient who has just undergone coronary artery bypass graft, CABG, surgery? It's D. Checking for patency of grafts and monitoring hemodynamic stability. Post-CABG, It's crucial to ensure the grafts are patent and the patient remains hemodynamically stable to prevent complications. Which heart sound is commonly associated with heart failure? It's B, S3. An S3 heart sound, also known as a ventricular gallop, is often associated with heart failure and indicates increased fluid volume or decreased ventricular compliance. A patient with a history of chronic hypertension is at risk for which of the following complications? It's B, myocardial infarction. Chronic hypertension increases the risk of myocardial infarction due to the added strain on the heart and the potential for atherosclerosis. Which intervention is most appropriate for a patient experiencing a myocardial infarction, MI, with ST elevation on the ECG? It's A, administer thrombolytics as ordered. ST elevation on an ECG indicates ST elevation myocardial infarction, STEMI, which often requires thrombolytics to dissolve the clot causing the infarction. What should the nurse include in the discharge teaching for a patient who has been prescribed warfarin? It's D, report any signs of bleeding immediately. Warfarin is an anticoagulant, and patients need to be aware of signs of bleeding due to the increased risk of hemorrhage. In a patient with aortic stenosis, which of the following symptoms is most indicative of worsening disease? It's A, shortness of breath with exertion. Aortic stenosis often leads to symptoms such as shortness of breath, especially with exertion, due to the reduced blood flow across the narrowed valve. What is the primary purpose of administering beta blockers to a patient with chronic stable angina? It's A, to reduce heart rate and myocardial oxygen demand. Beta blockers decrease the heart rate and workload on the heart, which helps reduce the frequency and severity of angina attacks. A patient with a known history of deep vein thrombosis, DVT, is being treated with enoxaparin. What should the nurse monitor closely? It's A, platelet count. Enoxaparin is a low molecular weight heparin used for anticoagulation, and monitoring platelet count is important to detect potential heparin-induced thrombocytopenia. Which symptom is most indicative of right-sided heart failure? It's C, jugular vein distension. Right-sided heart failure often leads to increased pressure in the venous system, resulting in symptoms such as jugular vein distension and peripheral edema. A patient with mitral valve prolapse is most likely to report which of the following symptoms? It's D, palpitations. Mitral valve prolapse can cause palpitations and sometimes chest discomfort, but it is not typically associated with severe chest pain or swelling. For a patient taking digoxin, which assessment findings should prompt the nurse to hold the medication and notify the provider? It's B, serum potassium level of 3.0 MEq/L. Digoxin toxicity can be exacerbated by hypokalemia, so a low potassium level is a critical finding that necessitates holding the medication and notifying the provider. Which clinical manifestation would most likely indicate aortic regurgitation? It's A, a diastolic murmur best heard at the left sternal border. Aortic regurgitation often presents with a diastolic murmur due to the backflow of blood from the aorta into the left ventricle. Which of the following should the nurse monitor closely in a patient receiving adenosine for the treatment of supraventricular tachycardia, SVT? It's D, heart rate and rhythm. Adenosine is used to terminate SVT and it is crucial to monitor the heart rate and rhythm closely for effectiveness and potential adverse effects. What is the priority assessment for a patient receiving an intravenous infusion of nitroglycerin for angina? It's A, blood pressure. Nitroglycerin is a vasodilator that can cause significant drops in blood pressure, so monitoring blood pressure is essential to prevent hypotension. Which dietary change should the nurse recommend to a patient with hypertension? It's A, decrease sodium intake. Reducing sodium intake is an important dietary change to help manage hypertension and reduce blood pressure. A patient with heart failure is being evaluated for the presence of a high-output failure. Which of the following conditions is most likely to cause high-output heart failure? It's A, severe anemia. High-output heart failure occurs when the heart pumps more blood than usual due to conditions such as severe anemia, where there is increased demand for oxygen delivery. Which symptom is most likely to be reported by a patient with a pulmonary embolism? It's C, sudden onset of shortness of breath. A pulmonary embolism commonly presents with sudden shortness of breath due to the blockage of blood flow in the pulmonary arteries. A nurse is caring for a patient who has been prescribed clopidogrel following a stent placement. Which teaching point is essential for this patient? It's D, you should avoid grapefruit juice while on this medication. Grapefruit juice can interact with clopidogrel, potentially increasing the risk of bleeding or affecting the drug's efficacy. Which of the following should be assessed first in a patient presenting with symptoms of endocarditis? It's B, temperature and signs of fever. Endocarditis often presents with fever and other systemic signs, so assessing for temperature and fever is crucial in the initial evaluation. For a patient with a history of mitral stenosis, which of the following symptoms should be reported immediately to the healthcare provider? It's D, severe shortness of breath at rest. Mitral stenosis can lead to pulmonary congestion and severe shortness of breath, which may indicate worsening of the condition and require immediate attention. What is the most appropriate nursing action for a patient who is experiencing dizziness and lightheadedness after being started on an antihypertensive medication? It's B, monitor the patient's blood pressure and heart rate. Dizziness and lightheadedness can be signs of hypotension due to antihypertensive medications, so it is important to monitor these vital signs closely. Which finding would most likely indicate the need for immediate intervention in a patient with aortic dissection? It's B, sudden onset of severe chest pain. Aortic dissection often presents with sudden severe chest pain and requires immediate medical intervention due to its life-threatening nature. What should be monitored closely when administering dobutamine to a patient with heart failure? It's A, heart rate and blood pressure. Dobutamine is a positive inotrope that can affect heart rate and blood pressure, so these parameters need close monitoring. In a patient with a history of chronic atrial fibrillation, which laboratory value is most important to monitor? It's D, International Normalized Ratio, INR. Patients with atrial fibrillation often require anticoagulants, so monitoring INR is essential to ensure effective anticoagulation and prevent complications. What is the most appropriate nursing intervention for a patient with a new onset of ventricular tachycardia? It's A, performing cardioversion or defibrillation if symptomatic. Ventricular tachycardia can be life-threatening and may require immediate cardioversion or defibrillation, especially if the patient is symptomatic. Which symptom is a classic sign of aortic stenosis? It's A, syncope. Aortic stenosis can cause syncope, fainting, due to reduced blood flow to the brain, particularly with exertion. Which of the following assessments is most important for a patient with a newly implanted automatic implantable cardioverter defibrillator? It's A, monitoring for signs of infection at the insertion site. Post-implantation, it is crucial to monitor the AICD insertion site for infection to prevent complications. A patient with heart failure reports increased shortness of breath and swelling of the lower extremities. What should the nurse do first? It's C, assess lung sounds and measure weight. These assessments are crucial to determine if fluid retention is worsening and to guide further treatment adjustments. Which of the following is a common side effect of statins used to manage hyperlipidemia? It's D, muscle pain and weakness. Statins can cause muscle pain and weakness, a condition known as myopathy, which needs to be monitored regularly. For a patient taking nitrates for angina, which instruction is most important? It's B, sit or lie down before taking the medication to prevent dizziness. Nitrates can cause hypotension and dizziness, so it is important to sit or lie down to minimize these effects. Which heart sound might indicate the presence of heart failure in a patient? It's A, S3. An S3 heart sound, also known as a third heart sound or ventricular gallop, is often associated with heart failure and indicates volume overload in the ventricles. A patient with myocardial infarction is scheduled for a percutaneous coronary intervention. What is the primary nursing action before the procedure? It's D. Ensure the patient is hydrated and has a patent IV line. Adequate hydration and a patent IV line are crucial for the PCI procedure to ensure the patient is well prepared and to facilitate the administration of medications and fluids. Which medication is commonly prescribed to reduce the workload on the heart in patients with congestive heart failure? It's A, furosemide. Furosemide is a diuretic used to reduce fluid overload and decrease the workload on the heart in patients with heart failure. A patient with heart failure is taking spironolactone. Which lab value should the nurse monitor closely? It's A, serum potassium. Spironolactone is a potassium-sparing diuretic, so monitoring serum potassium levels is essential to prevent hyperkalemia. Which symptom is most indicative of pericarditis? It's A, friction rub on auscultation. Pericarditis often presents with a characteristic friction rub due to inflammation of the pericardial layers. For a patient experiencing chest pain with an ST elevation on the ECG, which intervention is most appropriate? It's C, initiate thrombolytic therapy. ST elevation suggests ST elevation myocardial infarction, which often requires thrombolytic therapy to dissolve the clot. A patient with a history of coronary artery disease is prescribed clopidogrel. Which instruction is important for the nurse to provide? It's D, avoid grapefruit juice while taking this medication. Grapefruit juice can affect the metabolism of clopidogrel, potentially increasing the risk of bleeding. Which finding is most concerning in a patient who has just undergone cardiac catheterization? It's B, Severe pain and swelling at the insertion site. This could indicate a complication such as hematoma or infection and requires immediate evaluation. A patient with a pacemaker should be advised to avoid which of the following? It's A. Contact sports. Patients with pacemakers should avoid contact sports to prevent damage to the pacemaker or lead displacement. Which symptom should prompt the nurse to suspect that a patient with heart failure is experiencing a complication of fluid overload? It's B. Swelling of the lower extremities. Fluid overload in heart failure often leads to edema, particularly in the lower extremities. A patient on digoxin presents with nausea, visual disturbances, and confusion. What should the nurse do next? It's C. Check the serum digoxin level. These symptoms may indicate digoxin toxicity, so checking the serum level is crucial to guide further treatment. Which nursing intervention is most appropriate for a patient with a new diagnosis of mitral valve prolapse? It's A. Monitor for signs of infective endocarditis. Mitral valve prolapse increases the risk of infective endocarditis, so monitoring for symptoms of this infection is essential. A patient with heart failure is prescribed an ACE inhibitor. What should the nurse monitor for as a common side effect of this medication? It's D. Dry cough. A persistent dry cough is a well-known side effect of ACE inhibitors due to bradykinin accumulation. Which intervention is most appropriate for a patient with Prinzmetal's angina? It's A. Administer nitroglycerin as prescribed. Prinzmetal's angina is caused by coronary artery spasm, which is often treated with nitroglycerin to relieve the spasm. A patient with end-stage heart failure is being evaluated for a heart transplant. Which factor is most likely to disqualify a patient from being listed for a transplant? It's A. Severe, uncontrolled psychiatric illness. Severe psychiatric illness can be a contraindication for heart transplantation due to the need for strict adherence to post-transplant medication and lifestyle changes. Which finding is most concerning for a patient who has just started on a new antihypertensive medication? It's A. Persistent cough. A persistent cough could indicate an adverse reaction to an antihypertensive medication, particularly if it is an ACE inhibitor. A patient with heart failure is being treated with a combination of a beta blocker and a diuretic. Which of the following should be monitored closely? It's C. Serum potassium levels. Diuretics can affect potassium levels, and combining them with other medications such as beta blockers requires careful monitoring to prevent imbalances. What is the most appropriate action if a patient is experiencing a suspected myocardial infarction, MI, and is unresponsive to nitroglycerin? It's D. Administer aspirin and prepare for possible thrombolytic therapy. If nitroglycerin is not effective, the next steps involve administering aspirin to inhibit clot formation and preparing for thrombolytics if indicated. Which symptom is most indicative of right-sided heart failure? It's B. Jugular vein distension. Right-sided heart failure often leads to increased pressure in the venous system, causing jugular vein distension and peripheral edema. Which assessment finding is most likely in a patient with acute decompensated heart failure? It's B. Dyspnea at rest. Acute decompensated heart failure often presents with severe shortness of breath or dyspnea at rest due to fluid overload and pulmonary congestion. For a patient with chronic heart failure, which lifestyle change should be emphasized? It's A, quitting smoking. Smoking cessation is a crucial lifestyle change to improve overall cardiovascular health and manage chronic heart failure. What is the primary goal of administering thrombolytics to a patient with a myocardial infarction? It's D, to dissolve the clot obstructing blood flow to the heart. Thrombolytics aim to dissolve the clot causing the myocardial infarction, thereby restoring blood flow to the affected area. A patient with heart failure is receiving a dose of enalapril. Which side effect should the nurse monitor for? It's A, hyperkalemia. Enalapril, an ACE inhibitor, can cause hyperkalemia. Enalapril, an ACE inhibitor, can cause hyperkalemia, so monitoring potassium levels is important to prevent complications. Which action is most appropriate when caring for a patient undergoing cardiac stress testing? It's A, monitor the patient's heart rate and blood pressure during the test. Monitoring is essential to assess the heart's response to stress and detect any potential abnormalities. In a patient with mitral valve stenosis, which symptom is most likely to be reported? It's A, orthopnea. Mitral valve stenosis can cause pulmonary congestion, leading to orthopnea, difficulty breathing when lying flat. A patient with congestive heart failure, CHF, is experiencing weight gain and increased dyspnea. What should the nurse do first? It's C, evaluate for signs of fluid retention. Assessing for fluid retention helps determine if the symptoms are due to worsening heart failure, guiding appropriate interventions. What is the primary purpose of administering a beta blocker to a patient with heart failure? It's D, to decrease the workload of the heart. Beta blockers reduce heart rate and myocardial workload, which can help manage symptoms and improve outcomes in heart failure. Which nursing action is most appropriate for a patient experiencing paroxysmal nocturnal dyspnea? It's B, encourage the patient to sleep in a recliner or with multiple pillows. Paroxysmal nocturnal dyspnea is often alleviated by sleeping with the head elevated to reduce pulmonary congestion. A patient with end-stage heart failure is being considered for palliative care. Which aspect is most important to address? It's A, symptom management and comfort. Palliative care focuses on improving the quality of life through symptom management and comfort for patients with advanced illnesses. Which finding should be reported immediately for a patient receiving IV heparin? It's D, black tarry stools. This may indicate gastrointestinal bleeding, a serious complication of heparin therapy that requires immediate attention. For a patient on warfarin, which dietary recommendation should be emphasized? It's A, avoid foods high in vitamin K. Vitamin K can interfere with the effectiveness of warfarin, so it is important to maintain a consistent intake of vitamin K-rich foods. A patient with a history of deep vein thrombosis, DVT, is being discharged on anticoagulant therapy. What should the nurse emphasize about this medication? It's A, it is important to take the medication at the same time every day. Consistent timing helps maintain stable drug levels and effectiveness in preventing clot formation. Which of the following symptoms should be reported immediately for a patient with aortic aneurysm? It's A, severe abdominal pain. Severe abdominal pain could indicate a rupturing aneurysm, which is a medical emergency requiring immediate intervention. In a patient with stable angina, which of the following should be avoided? It's C. Heavy meals. Heavy meals can exacerbate angina by increasing myocardial oxygen demand, so they should be avoided. A patient with cardiomyopathy is at high risk for which complication? It's D. Stroke. Cardiomyopathy can lead to the formation of blood clots due to poor cardiac output, increasing the risk of stroke. Which symptom is most likely to be reported by a patient with atrial flutter? It's B. Rapid, irregular heartbeat. Atrial flutter typically presents with a rapid and irregular heartbeat, often described as a racing feeling. What is the priority nursing action for a patient experiencing an acute myocardial infarction? It's D. Providing oxygen therapy. Administering oxygen helps ensure adequate oxygenation of the myocardium and reduces damage during an acute MI. Which finding is consistent with a diagnosis of congestive heart failure, CHF, exacerbation? It's B. Decreased urine output. Exacerbation of CHF often results in decreased urine output due to fluid retention and impaired renal perfusion. Which medication is often used to manage ventricular arrhythmias? It's B. Lidocaine. Lidocaine is an antiarrhythmic medication commonly used to manage ventricular arrhythmias. What is the primary benefit of using a beta blocker in a patient with myocardial infarction? It's A. Reducing myocardial oxygen demand. Beta blockers decrease myocardial oxygen demand, which helps limit the extent of damage during a myocardial infarction. Which condition is most likely to lead to the development of coronary artery disease? It's D. Hyperlipidemia. Elevated levels of lipids in the blood are a major risk factor for the development of coronary artery disease. A patient with an implanted cardioverter defibrillator should be monitored for which of the following? It's A. Signs of device malfunction. Monitoring for signs of ICD malfunction is essential to ensure proper device function and patient safety. In managing a patient with hypertensive crisis, what is the primary goal of treatment? It's A. To lower blood pressure gradually and safely. Rapidly lowering blood pressure in a hypertensive crisis can cause complications. Thus, it should be done gradually. Which sign is most indicative of a myocardial infarction in women? It's A. Unexplained fatigue and shortness of breath. Women may present with atypical symptoms such as fatigue and shortness of breath during a myocardial infarction. A patient is experiencing bradycardia following the administration of a beta blocker. What should the nurse do first? It's C. Administer atropine as prescribed. Atropine can be used to treat bradycardia induced by beta blockers. Which dietary change should a patient with a history of myocardial infarction be advised to make? It's D. Limit intake of trans fats and cholesterol. Reducing trans fats and cholesterol is important to lower the risk of future myocardial infarctions and improve overall heart health. What is the primary nursing consideration when caring for a patient with a pericardial effusion? It's B. Monitoring for signs of cardiac tamponade. Pericardial effusion can lead to cardiac tamponade, which requires careful monitoring for symptoms such as hypotension, distended neck veins, and muffled heart sounds. Which symptom is most likely to be experienced by a patient with mitral regurgitation? It's A. Fatigue and dyspnea. Mitral regurgitation can lead to volume overload in the left atrium and pulmonary congestion, causing fatigue and shortness of breath. A patient receiving antihypertensive medication reports a persistent dry cough. What should the nurse do next? It's D. Consult the healthcare provider about changing the medication. A persistent dry cough is a common side effect of ACE inhibitors, and the healthcare provider may need to adjust the medication regimen. What is a key nursing intervention for a patient undergoing cardiac catheterization? It's A. Monitor the patient for signs of bleeding at the catheter insertion site. Post-catheterization, monitoring for bleeding and other complications at the insertion site is crucial for patient safety. Which medication is commonly prescribed for a patient with chronic stable angina? It's A. Amlodipine. Amlodipine is a calcium channel blocker often used to manage chronic stable angina by reducing myocardial oxygen demand. A patient with acute coronary syndrome, ACS, should be monitored closely for which complication? It's A. Cardiac arrhythmias. ACS can lead to various cardiac arrhythmias, making it important to monitor for and address any arrhythmias promptly. Which intervention is most appropriate for a patient with chronic venous insufficiency? It's C. Encourage elevation of the legs. Elevating the legs helps reduce venous pressure and improve blood return, alleviating symptoms of chronic venous insufficiency. What should a nurse educate a patient about when starting a new statin medication? It's D. Monitor for signs of muscle pain or weakness. Statins can cause muscle-related side effects, so monitoring for muscle pain or weakness is important for early detection of potential complications. In the management of a patient with aortic stenosis, what is a key focus of care? It's B. Monitoring for symptoms of heart failure. Aortic stenosis can lead to heart failure, so monitoring for symptoms such as dyspnea and edema is crucial. What is the main purpose of using a cardiac monitor in a patient with suspected arrhythmia? It's D. To assess heart rate and rhythm. Cardiac monitors are used to continuously assess heart rate and rhythm, which helps diagnose and manage arrhythmias. Which assessment finding is most indicative of left-sided heart failure? It's A. Pulmonary crackles. Left-sided heart failure often leads to pulmonary congestion, which can be detected as crackles or rales in the lungs. A patient with coronary artery disease is prescribed a new medication. Which of the following should be closely monitored? It's A. Serum potassium levels. Many medications used to treat coronary artery disease, such as diuretics or ACE inhibitors, can affect potassium levels. What is the primary goal of administering angiotensin, 2 receptor blockers, to a patient with heart failure? It's A. To lower blood pressure and reduce cardiac workload. ARBs help lower blood pressure and reduce the workload on the heart, which is beneficial in managing heart failure. A patient presents with sudden onset of severe chest pain radiating to the back and shoulders. What is the most likely condition? C. Aortic dissection. Sudden severe chest pain radiating to the back and shoulders is characteristic of aortic dissection, a life-threatening condition. Which test is commonly used to diagnose myocardial infarction? It's D. EKG, electrocardiogram. An EKG is commonly used to diagnose myocardial infarction by identifying characteristic changes in the heart's electrical activity. A patient with heart failure is experiencing significant dyspnea and has a respiratory rate of 30 breaths per minute. What is the most appropriate nursing intervention? It's D. Administer oxygen as prescribed. Providing supplemental oxygen helps alleviate dyspnea by improving oxygenation and reducing the workload on the heart. A nurse is assessing a patient who has been diagnosed with ventricular tachycardia, VT. Which finding is most concerning? It's A. Absence of a detectable pulse. VT without a detectable pulse is a medical emergency, indicating that the heart is not effectively pumping blood and immediate intervention is needed. What is the primary purpose of administering a beta blocker to a patient with hypertension? It's B. To reduce blood pressure by decreasing heart rate and myocardial contractility. Beta blockers lower blood pressure by reducing the heart's workload and slowing the heart rate. Which symptom is most indicative of aortic regurgitation? It's C. Dyspnea on exertion. Aortic regurgitation leads to increased volume load on the left ventricle, causing symptoms like dyspnea on exertion due to pulmonary congestion. Which dietary recommendation should be given to a patient taking a potassium-sparing diuretic? It's A. Decrease intake of potassium-rich foods. Potassium-sparing diuretics can cause hyperkalemia, so it is important to monitor and potentially limit potassium intake. A patient with atrial fibrillation is prescribed warfarin. What should the nurse educate the patient about? It's A. The importance of regular INR monitoring. Warfarin requires regular INR testing to ensure the blood clotting time is within the therapeutic range and to prevent bleeding complications. Which clinical manifestation is commonly associated with rheumatic fever affecting the heart? It's A. Erythema marginatum. Rheumatic fever often presents with erythema marginatum, which is a characteristic rash, along with other symptoms affecting the heart. Which of the following medications is commonly used to treat chronic stable angina? It's B. Diltiazem. Diltiazem is a calcium channel blocker used to manage chronic stable angina by reducing myocardial oxygen demand and improving blood flow. A patient is admitted with suspected pericarditis. What is the most likely assessment finding? It's AC, friction rub on auscultation. A pericardial friction rub is a classic sign of pericarditis and can be heard on auscultation of the chest. What is the most appropriate action for a nurse to take when a patient with a new pacemaker experiences dizziness and a heart rate of 40 beats per minute? It's A. Assess the patient for signs of pacemaker malfunction. Dizziness and a low heart rate may indicate that the pacemaker is not functioning correctly and needs to be evaluated. A patient presents with symptoms of acute coronary syndrome, ACS. Which laboratory test is most critical for confirming myocardial damage? It's D. Troponin levels. Troponin is a protein released when the heart muscle is damaged, making it a key biomarker for confirming myocardial damage. What is a common side effect of digoxin that the nurse should monitor for? It's A. Visual disturbances. Digoxin toxicity can cause visual disturbances, such as yellow-green halos around lights. Which symptom is most indicative of a myocardial infarction, MI, in elderly patients? It's B. Confusion or altered mental status. Elderly patients may present with atypical symptoms, such as confusion or altered mental status during an MI. Which intervention should be prioritized for a patient presenting with signs of heart failure exacerbation? It's C. Administering diuretics. Diuretics help manage fluid overload, which is a key issue in heart failure exacerbation, thus relieving symptoms such as edema and dyspnea. A patient with a history of chronic atrial fibrillation is at risk for which complication? It's A. Stroke. Atrial fibrillation increases the risk of stroke due to the formation of blood clots in the atria. Which sign is most indicative of aortic stenosis? It's D. Systolic ejection murmur. Aortic stenosis often presents with a characteristic systolic ejection murmur, heard best at the second right intercostal space. For a patient with a newly placed coronary artery stent, which medication is crucial to prevent clot formation? It's A. Clopidogrel. Clopidogrel is an antiplatelet medication used to prevent clot formation in patients with coronary artery stents. What is the primary goal when treating a patient with hypertensive urgency? It's B. Gradual reduction of blood pressure over a period of hours to days. In hypertensive urgency, blood pressure should be reduced gradually to avoid complications. Which finding is most likely in a patient with right-sided heart failure? It's C. Jugular vein distension. Right-sided heart failure leads to fluid retention and increased venous pressure, resulting in jugular vein distension. A patient with an implanted defibrillator, ICD, reports feeling lightheaded after the device delivers a shock. What should the nurse do first? It's A. Assess the patient's vital signs and level of consciousness. After an ICD shock, it's important to assess the patient's vital signs and level of consciousness to determine if further intervention is needed.
Alright, thank you for watching. I hope these cardiology NCLEX RN questions and rationales help you to boost your confidence. A special thanks to US RN Elite for sponsoring today's video. If you are aiming to pass your NCLEX exam with expert guidance, I highly recommend enrolling with US RN Elite. They offer in-depth help with ECG calculations, interpretations, CGFNS registration, and they even assist candidates with direct high offers. And recently, they've been helping Ghanaian nurses who want to write in Kenya with accommodation and transport. You have to contact them. I'll leave their details in the description. Don't forget to like, share, and subscribe to the channel. And be sure to watch other videos in our NCLEX playlist, which is on the left corner here. Good luck with your studies and see you in the next video.